Hi everyone, my name is Jackie Orellana. Today I'm going to take you through a medical mystery and we'll follow a patient's case step by step from her symptoms to her diagnosis and treatment. And for our case study, our patient is a 35-year-old woman. She comes in with a main complaint of vaginal bleeding after intercourse. She also reports pelvic pain and unusual discharge. These symptoms might seem common, but when they occur together and continue, they could point to something serious. And there are some really red flags here as well. So we might ask ourselves some questions like, what other symptoms would you ask about? What exams or tests would you order? Could this be an infection? Or could it be a hormonal imbalance? Looking at her history, we find several red flags. For example, bleeding after intercourse for 3 months, irregular periods and lower back pain, no pap smear in over 7 years, which is really concerning. And she is also a smoker and has had multiple sexual partners. And during the physical exam, her cervix does look inflamed with a lesion that bleeds on contact. And pap smear results show high grade abnormal cells, and she tests positive for the HPV-16 strain, which is a high risk strain. A biopsy confirms cervical cancer. And one question we might ask ourselves is, what risk factors in this patient's history might have contributed to her diagnosis? Now with transmission, let's talk about how HPV actually causes problems. So HPV is short for human papilloma virus and it spreads through sexual contact. It gets into the body through small cuts or abrasions in the skin, as we can see right over here in the photo. And once inside, it does infect the basal cells of the cervix and stays hidden for a while. Most people don't even know they have it, but high risk strains like HPV-16 can stay for years and cause major changes to the cells. And here I have a photo of the demonstration of the HPV pathogen entering the skin abrasion, how it goes through the layers, and we see some immune defense cells like the killer T cell, the dendritic cell, and even the CD4 T lymphocyte. For pathogenesis, in the early stages, HPV doesn't cause major changes. It mainly hides in the cells and replicates slowly, but as infected cells mature and move upward, the virus becomes more active. It starts making viral proteins like E6 and E7, and these proteins block the body's natural tumor suppressors like P53 and PRB. And these are like the body's security guards. When they're blocked, damaged cells can grow and multiply freely. And as for the progression, in high risk cases, the virus can even integrate into our DNA, and this often breaks a gene which is E2, and this normally keeps E6 and E7 in check. And with E2 out of the picture, E6 and E7 levels go up even more, and this can lead to genomic instability. And this basically means that the cells become more and more damaged over time. About over 10 to 20 years, they can develop into cervical cancer. Some questions that we can ask ourselves right now could be, why do you think HPV often goes unnoticed? And what makes HPV-16 more dangerous than the others? For signs and symptoms, early signs might include warts or unusual looking cells that are coelocytes. Later on, you might even see precancerous changes like cervical intraepithelial neoplasia. And if they're not treated, they can eventually turn into invasive cervical cancer. And here I do have a photo of the stages. Here it is normal, so you don't see anything. It is a healthy cervix, as we see over here as well. And as the stages further, we start to see more inflammation and more redness in the cervix. And we see now here in the latest stage, we see the cancer tissue and bleeding. And here in the cervix, you could also see the bleeding as well. And some questions we might ask ourselves again are, what are some signs that might help catch this early before it becomes cancer? For epidemiology, cervical cancer is becoming more common in younger women. About 40% of cases now occur in women under 45. The biggest problem is in developing countries where about 85% of cervical cancer deaths happen. And some of the risk factors could be early sexual activity, multiple partners, smoking, weakened immune system, long-term birth control use, and lack of screening. In 2008, there were 529,000 new cases of cervical cancer. In 2018, that number grew to 570,000. It's now the fourth most common cancer in women worldwide. In China, there were about 99,000 new cases in 2015 alone. Many women live with complications like infertility, pelvic pain, or reoccurrence, and in 2018 there were over 311,000 deaths, most of them in low income countries. For diagnosis, when a patient presents with symptoms like vaginal bleeding and pelvic pain, there are several possible causes that needs to be considered. And this could be endometrial cancer, which also causes abnormal bleeding, vaginal cancer, which can produce similar discharge or discomfort, or cervicitis, which is just inflammation of the cervix and sometimes due to infection as well. These conditions can look very similar to cervical cancer at first, so proper testing is really important to figure out what's going on. And some questions we might ask ourselves is, how might you tell the difference between cervicitis and cervical cancer? Here I have some photos of the tests that were done for the progression of cervical cancer. Here we have a pap smear where the pap smear was done and it revealed squamous cell carcinoma in the cervix. And as we can see, we see the enlarged nucleus all around over here as well. And over here we have the biopsy being done for cervical cancer. And as we can see, we do see some bleeding and very much of inflammation. And it is cervical intraepithelial neoplasia. Now moving on to diagnosis. The first test we usually do is a pap smear. It checks for abnormal or precancerous cells on the cervix. A small sample is collected and sent to the lab to look for changes that could lead to cancer. If the results are abnormal, the next step is often an HPV test, and this test checks for high-risk HPV types like HPV 16 and HPV 18. And if either test is concerning, doctors do a colposcopy, and this is a closer look at the cervix using a special microscope, and if needed, a biopsy is taken to confirm if cancer cells are present. In some cases, doctors might also do HPV genotyping. This is a lab test that tells exactly which type of HPV is present. Knowing if the patient has HPV 16 or 18 is very important because these are the strains most likely to lead to cancer. Once cancer is confirmed through a biopsy, the next step is staging. This tells us how far the cancer has spread. One of the best tools for this is a PET scan and also the CT scan. And the purpose of these tests is to help doctors find out if cancer has spread to nearby lymph nodes. And it basically works by they combine the PET scans and the CT tests to show where the cancer might be, especially in small areas like lymph nodes. Moving on to treatment. Treatment depends on the stage and the patient's overall health. For early stages like 1A, surgery might be done, like for example, a radical hysterectomy, which is the removal of the uterus and surrounding tissue for other stages as well, and also a radical trachelectomy, which is used in some cases of early stage cancer for women who want to preserve fertility. And for more advanced stages, radiation and chemotherapy can also be used. Common therapy drugs include cisplatin and paclitaxel, and cisplatin stops cancer cells from dividing, and paclitaxel prevents them from growing, and new treatments are being studied like immunotherapy, which helps the immune system attack cancer, and targeted therapy, which focuses on specific molecules in the cancer cells. For control measures, cervical cancer is one of the most preventable cancers. The HPV vaccine plays a big role in this. It is recommended at ages 11 to 12 before exposure, and for screening, for ages 21 through 29, Pap smear is every 3 years. For ages 30 through 65, Pap and HPV test every 5 years. And for 65 and up, no screening unless your doctor says otherwise. We can also lower the risk through healthy choices, and this could be like avoid smoking, practice safe intercourse, eat healthy and exercise, and educate others, of course, especially in areas where access to care is limited. With better screening and vaccination overall, we can greatly reduce and even eliminate cervical cancer in the future. In conclusion, cervical cancer is preventable and treatable if caught early. Early detection through regular screenings and HPV vaccination can reduce the risk. For future implications, expanded HPV vaccine coverage could create more protection. And a fact is, cervical cancer rates have dropped due to screenings and vaccination, but it remains a big concern in countries with limited access. And in conclusion, with continued focus on education, vaccination, and screenings, cervical cancer could be eradicated in future generations. And one last question to ask is, what role do lifestyle choices play in both preventing and managing cervical cancer? Thank you for listening. And here is my bibliography.